Hey, y'all.
What up, y'all? And welcome to the Birth Squad podcast. If you've been riding with the squad,
hey, fam.
And if you're new,
welcome to the squad.
We're your hosts, Dr. Ijama Kwandu and Dr. Kamisha Thomas, two licensed obstetricians and gynecologists, as well as best friends.
We use real stories to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope you love learning about our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. Please consult your healthcare provider for your specific care.
So to learn more about us and for more information, please visit our Instagram at The Birth Squad and our Twitter at _The Birth Squad.
Please keep in mind that the following episode may cover topics that could be triggering to some individuals. Listener discretion is advised.
Meet Dr. Brittney Johnson. She's the next badass birth warrior who will share her story to help the Birth Squad navigate through the complex and inspiring journey of pregnancy, labor, birth, and motherhood.
This is an important episode because we are talking about the most common delivery complication, postpartum hemorrhage. During the interview, you may notice some medical terms or jargon, but don't worry, like always, we got you. We have included definitions and explanations in the episode description, so please listen up and enjoy her story.
Hey y'all, we are back with the Birth Squad, and I have the pleasure of introducing our badass birth warrior, Dr. Brittney Johnson. Hi, Brittney.
Hello, thank you for having me. I'm excited.
Of course, we're so excited to have you. We're just going to go ahead and get right into it. Can you tell us a little bit about yourself, your age, your family dynamics, and kind of what kind of called you on your path to motherhood?
So I am 35. I'm married. We decided in 2021, halfway or midway through the year, that we were ready, like we were committed to one another and we wanted to go ahead and start a family. Me being an OBGYN, I had an IUD. I pulled that out myself. And then
that's very impressive, by the way. We do not recommend you do that at home. Don't try it at home.
Yes, please don't.
Once my period returned, then I started tracking to see when I was ovulating, and then we were able to get pregnant that way.
Perfect. So how are your feelings when you first found out that you were pregnant?
So because I was like, we were purposefully trying to get pregnant, I was like using the pregnancy, the HCG sticks, and trying to see like, was it positive? Did it work? The HCG is basically just when you're doing a urine pregnancy test, you're checking for HCG, or when you get a blood pregnancy test, that's what you're checking for. And then I started getting afraid, like, please don't let it, because I'm always thinking like the worst could happen. I was thinking maybe I might have, a miscarriage. So I was like, an ectopic pregnancy. An ectopic pregnancy is basically just one that's not inside the uterus. It can be very bad for a person. They typically may require surgery. So I was just, me being the doctor, I was thinking the worst potential scenarios. Yeah, I was a little extra, a little frightened of what was coming next. It was just a lot of different feelings, excited, but scared, knowing that I would have a different identity in the next 9 months.
Now, right off the bat, Brittney goes through quite a few topics. We're going to go ahead and break it down.
100%. First off, Brittney mentions a common birth control method, an IUD, which stands for intrauterine device. There are multiple types, some with hormones and one without. In each case, the IUD requires placement and removal in the office. Despite what Brittney just said, please do not remove it yourself at home. This form of birth control has not been shown to affect future fertility or your ability to conceive after removal. The only birth control that has been documented to influence this is the birth control shot, which is also known as the depot shot. And even in this case, most will be able to conceive after a few months.
Now, Brittney also mentioned her fears about miscarriage and ectopic pregnancy. These fears are completely normal and totally understandable. The truth is, miscarriage is super common. It actually happens in about 1 in 4 birthing individuals. That's a whopping 25%. We want you to know that you are not alone. Most people have experienced a miscarriage. It's just not talked about very much, and there can be a lot of shame and sadness around it. We will cover this topic in more detail in a future podcast, so tune in.
While miscarriage is common, an ectopic pregnancy is not. This counts for about 2% of all pregnancies in the US. As Dr. Johnson stated, an ectopic pregnancy is a pregnancy outside the uterus, most commonly found in the fallopian tube. Now, this is a life-threatening condition. A pregnancy in the fallopian tube can rupture and cause the pregnant person to bleed into their abdomen. This pregnancy cannot survive. Most ectopic pregnancies can be managed medically if diagnosed early, but some will need surgical management. Risk factors for developing an ectopic pregnancy include a history of prior ectopic, a history of pelvic inflammatory disease, or PID, and pregnancy resulting from fertility treatments. But oftentimes, we don't have a reason for why it happened. Symptoms include abnormal bleeding and pelvic pain. If you think you have an ectopic pregnancy, please seek care immediately. I know that was a lot and it was scary, but we just wanted to give you information and we wanted you to feel prepared, okay, y'all? Just keep in mind that this is rare. Now let's get back to Brittney's story.
So now you found out that you're pregnant. What was the pregnancy experience like for you?
I was anticipating a lot of nausea, a lot of food intolerances or aversions, or not wanting to eat certain things. I was going back and forth whether or not if I was going to have Kamisha be my OBGYN versus going to an outside doctor that didn't know who I was. So that way, like, my husband could get like a full, experience, and the person not just assume like, oh, you're going to be able to, to communicate to him what it is that's happening, or, what we're talking about during our visit.
And go ahead and tell them why you didn't choose me. Go ahead.
Because Kamisha can't hold water. So I was like, if I go to her for my pregnancy confirmation, everybody is going to know by the time I leave the office that I'm pregnant.
I hear you on the whole lack of holding water. I've experienced it myself from time to time.
Yes, exactly. So I was like, she took it personally when I finally told her that I was pregnant, and I had not told her, but I was like, come on now.
Because I had figured it out. That's why I already knew she was pregnant, and I was just waiting for her to tell me. And then I had no idea that she was willing to let me be her OB. I was like, wow. Like, I was like very honored, but surprised. And then I was like, dang, I didn't even know I was in the running. So Brittney, am I in your squad now?
Of course, you were going to be the captain.
Am I delivering your next baby? Can I deliver your baby? Come on.
I guess, yeah. It won't be a surprise at this point. So, but no, the other thing is like, okay, we didn't want to know the gender of the baby, and I was certain that Kamisha would try to find out what the gender was. I keep that
secret so well for our patients. I just want to put that.
Let me just say that Kamisha definitely upholds HIPAA, okay?
No, she would try to find out the gender for herself.
She likes to know things. She likes to know things for herself. Yes, for sure.
Yeah.
Well, yes. And I also would like to say that if you are her doctor, Kamisha, Brittney will still be the captain of the squad.
No, I definitely, even beforehand, I knew Kamisha, she has excellent bedside manner and very well trained. So I would feel very safe and comfortable and well taken care of under her care. It was just more of a, not wanting to tell my colleagues too early, and also wanting to keep the gender secret, so next time I'll definitely go to Kamisha.
Put that for our listeners that this is not a paid sponsorship, okay? She's saying this of her own free will.
Oh, yes, 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 yes. That was the other thing that I was thinking about. I wanted to make sure that whoever I went to, I had a connection with them, and that also that they had concerns about my well-being, because I know that being a Black mother or a Black woman being pregnant, that I face a lot of risk, regardless of who I am.
Now, this is an important topic that we want to highlight. The process of pregnancy and giving birth can be even more complicated when considering the social implications of race in America. As Brittney mentioned, data has shown that Black people have higher rates of poor maternal outcomes. The New York Times actually recently highlighted a California-based study that included data from 2 million births. The results show that in general, people with higher economic status had better outcomes. The richest mothers and their newborns were more likely to survive the first year after childbirth, except when the family was Black. In fact, the wealthiest Black mothers and their babies were twice as likely to die. The study demonstrates that Black families, regardless of their socioeconomic status, are disproportionately affected by poor childbirth outcomes. At the end of the day, it is not an individual's race, but rather the intricate ways in which racism is woven into society and institutions, including medicine, that influences these outcomes. We will include the New York Times article and the referenced California-based study in the episode notes. Now let's get back to Brittney's story. So now let's fast forward to the actual delivery. What were the events leading up to that?
Well, I did go to Kamisha leading up to my delivery. I was trying to do everything to induce my labor. And once I got, past full term, past 37 weeks, I was trying to do everything to help my body go into labor naturally. And it just wouldn't work. And so I ended up having to undergo an induction of labor, where they put me into labor the day after my due date. And so I wasn't expecting that. I was hoping that I would be able to induce my own labor and be able to experience labor at home, and then go to the hospital and, within a couple hours have my baby, or, very quickly have my baby. But that wasn't the case.
So what methods were used for your induction?
So when I got there, Kamisha had already checked me multiple times prior, and I know that I was at least 3 centimeters, but my doctor still put a balloon in to stretch my cervix more. That stayed in for maybe like an hour. And then after that, we were on Pitocin, and that was for about maybe 12 hours. And then the contractions, like, they went from like 0 to 100. Like they were building, but like, I don't know what, I think I was transitioning. My labor was transitioning, and it would just like the pain just went from 0 to 100. And at that point, like I really thought I had to use the restroom. The nurse wouldn't let me go to the bathroom. And so I was like, okay, we'll turn off the Pitocin and get the anesthesiologist to come give me an epidural. Like, because it was just like, most of the time when you hear that someone who's in labor wants to go to the bathroom to go number 2, you're assuming that that means that it's the baby.
And we definitely don't want to deliver a baby in the toilet.
I knew it wasn't the baby, but either way, I got the epidural, and then and I delivered maybe 6 hours after that. My induction was around 23 hours.
Brittney just described her induction. If you want to hear more specific information on the various methods of induction, please refer to episode 3, Oni's Story, where we discuss this topic. You can also check out our Instagram for more information about natural induction methods. Brittney is also going to mention these options, but please make sure to discuss them with your doctor or your birth provider before trying any of these. Now, Brittney is going to share her labor experience. Please be advised that this could be triggering for those who have experienced labor and birth. We recognize and understand the significance of birth trauma.
So a pretty fast induction, because I always tell my patients an induction can take anywhere from a day upwards of 3 days. So you were really on the fast track.
Well, I think it was because of all the things that I was doing leading up to my induction, trying to get my body ready or to go into labor on its own. And so I think that's probably, I started off like with a very good point for my cervical exam or cervical status.
What kind of things are you doing?
Sex, a lot of sex.
Sounds fun.
Nipple stimulation, so using my breast pump a lot, using an exercise ball while I was using my breast pump, so like just kind of activating my leg muscles, because then usually you're able to get more contractions that way. What else? Castor oil. It was really bad. I have PTSD from castor oil. Like, I went from telling all my patients to drink castor oil to where I hardly ever mention it now.
I have to agree with you. I took castor oil in solidarity with my sister who was trying to induce her labor. And when I tell you, I was up all night. And when I tell you, your girl doesn't have a gallbladder, so it did not go down.
Yeah.
It came up.
Oh my, yeah. And I had I ordered a big, I think 8-10 ounce bottle, because I was like, this is going to work. This is the last thing that I'm going to use in this toolbox, and this is going to work. And I drank the whole bottle over the course of a week and a half. And I literally now I smell things, and sometimes it reminds me of castor oil, and it makes me nauseous.
Just you saying it right now makes me very nauseous.
Yes. And it's so crazy because now I'm using castor oil on my baby's hair and on my hair. And I'm like, oh, this is
can't
brings
stand
back
the smell.
memories. Yeah, brings back a lot of memories.
So when would you say that people should, if they are thinking about trying these natural ways of inducing, at what gestational age?
So definitely want to talk with your doctor, but at least waiting until 37 weeks, because at that point you're technically considered term. Although it's early term, if you were to have a baby at that point, most of the time they transition really well. Ideally, the closer you get to 39 weeks, the lowest risk for your baby.
So now you've delivered your baby.
Mm-hmm.
You're holding your baby in your arms, hopefully taking in the moment with your partner.
Mm-hmm.
What happened next?
So everything actually, the first hour or two was going very well. My mom was able to be there. So she was taking a lot of pictures and holding the baby. My partner, he was doing skin to skin with baby as well after I, while they were cleaning me up and everything. And then it was to the point where we were actually getting ready to move over to our postpartum room. And the nurse was helping me to go to the restroom to make sure that I could pee on my own. And at that point, when I started to use the restroom, then just a lot of clots started coming out. So they moved me back over to the bed, and then just more clots. She kept pressing on my uterus, and just more clots kept coming out. And at that point, I started to get really nervous because I knew what was happening. And my doctor had left because this is 2 hours, after delivery. He was already done, placenta delivered and everything. So I started kicking into okay, I need to tell the nurse what she needs to bring me for medications. And also at the same time communicating to my partner what was happening. So that way, if I had lost consciousness or something, he could advocate on my behalf.
So just for everyone to know, what exactly was happening?
So I was having a postpartum hemorrhage.
So Kamisha and I are now going to break down what exactly is a postpartum hemorrhage.
A postpartum hemorrhage is blood loss resulting from a delivery that is greater than 1,000 cc's or 1 liter in the first 24 hours of delivery. Now, this is regardless of whether it's a C-section or a vaginal delivery.
Okay, so now we know what a postpartum hemorrhage is. Let's talk about what are the risk factors for a postpartum hemorrhage.
The most likely cause of a postpartum hemorrhage is what is called uterine atony, which is decreased muscle tone. Because remember, at the end of the day, your uterus is a muscle.
Yes, so basically, I like to describe it as the uterus just ran a marathon. So after delivery, your muscle of the uterus is super tired. It literally was just running for hours and hours, working, contracting, getting your baby out. And now what we're asking it to do at the end of running such a long marathon is, hey, uterus, get up on that stage, start flexing your muscles as hard as you can. When really all the uterus would rather do is completely just flop down on the track and just rest and be all floppy. It'd be like, nah, I'm not flexing. I'm tired as hell. That's exactly what uterine atony is. And when that happens, heavy bleeding can start.
Yes, I love that comparison. In addition to the muscle being tired because of atony, there are other things that can over distort or distend the uterus and cause atony. For example, having lots of amniotic fluid or twins. These are things that stretch the uterus, therefore making it harder to clamp down. Other risks for a postpartum hemorrhage are infection, prolonged labor, and being on certain medications for a really long time, like Pitocin. Additionally, a laceration can sometimes cause a lot of bleeding, clotting disorders, or the placenta not coming out in a timely fashion.
Luckily, we have methods and medications to treat a postpartum hemorrhage. But as you can imagine, it can be really scary and a traumatizing situation. The good thing is that while it is the most common complication, OBGYNs are really well trained in managing this because it happens so frequently. I'm going to break down the ways in which a postpartum hemorrhage can be treated. Number one, medicines. These medicines can be given orally, by injection, or placed rectally. Yes, rectally. The second is pressure. So we could use a balloon that goes inside of the uterus and it's filled with water, and that helps put pressure on the uterus. Or we can stuff some gauze inside of the vagina. Again, that applies more pressure. Number three, procedures can be done, such as a procedure to help remove any leftover birth products in the uterus, or a procedure that can help slow down the blood flow from the uterus. And lastly, number four, surgery. And that would be called a hysterectomy. It is our last resort and a life-preserving measure. By removing the uterus, it helps stop the bleeding. We will include the management details for postpartum hemorrhage in the episode notes. Now let's get back to the story.
At the end of everything, I lost almost close to 2 liters after they weighed everything and estimated how much I had lost in the toilet. So it was quite a bit of blood loss. And usually it happens like within the first 24 hours of delivery. So the Coke can is about 200, maybe 250. And so 2 Coke cans is about a normal amount, but now you can go up to 1,000 for a vaginal delivery. And that still be considered normal. So I almost lost 2 liters.
That's a lot of blood.
Yeah.
That must have been so scary, wearing so many hats as the patient, the partner, right?
Yeah.
Because now you're trying to manage what your partner to understand what's going on. And then you also had your physician hat on.
Yeah.
And then also you had your colleague hat on, because then you needed to somehow get the message effectively to your doctor.
Mm-hmm.
But you had your medical expertise to be able to communicate that.
Yeah, I was truly blessed to be able to have the background and be able to, luckily the hospital where I delivered, I was already, I had worked there previously during residency. And so the nursing staff were familiar with me, and it wasn't like some random person is, just asking for things. And so they took my requests and my concerns more seriously. I think that they heard me because they knew who I was. And so I know that I was privileged to be able to have that, because a lot of people in similar scenarios, even if they do know that something's wrong or they are asking for something, they're not heard.
So even Brittney, a fellow OBGYN, was scared, and for good reason. If we can't get the bleeding to stop, then in the most severe circumstances, as Ijama mentioned earlier, you may need to have surgery immediately to have your uterus removed to save your life.
Unfortunately, people have lost their lives in the United States to postpartum hemorrhage or other birth complications, especially Black birthing individuals. There have been multiple stories of patients not being heard or listened to, and then it leading to significant maternal morbidity and sometimes mortality. Some examples include Serena Williams, Shalone Irving, and Kira Dixon. Fortunately, Serena did survive her birth, but Shalone and Kira, they lost their lives. Their stories highlight the inequity that Black patients may experience in the United States and the importance of advocating for yourself and also having your squad there to speak up for you. Let's get back to the story to discuss how Brittney's postpartum hemorrhage was treated. So what medications were used for your treatment of your postpartum hemorrhage?
So I asked the nurse to get a medication called tranexamic acid. We call it TXA, to get Cytotec, which is a medication that's a pill form that you can either give to a patient and place it rectally, under the tongue, or if it's not vaginal bleeding heavy, then you could also place it vaginally, or different ways of taking it. And then also I asked the nurse just to have like 2 additional medications like Hemabate or Methergin, just in case if that wasn't enough.
And then did you have any symptoms during the postpartum hemorrhage?
So during the postpartum hemorrhage, I think it was more so my nerves that I started to get really anxious as it continued to progress. Started to cry, honestly, because I was afraid that, things weren't going the right direction. And I was going to be a statistic. I became afraid, but I didn't. Most of the time, if you become anemic or if you're having a hemorrhage, your heart rate will start to increase, your blood pressure will start to drop. You might lose color or become pale, or other signs or symptoms of anemia. I don't think I really experienced those. Afterward, I felt a little dizzy, but I didn't think it was too bad.
Now, based on how much blood you lost, was there any discussion about a blood transfusion?
So I personally was asking, I want my doctor to order some labs to check for anemia, to see how low I dropped, and also to trend it from immediately after delivery to the next day to see, what was the drop. Because I was already already had anemia of pregnancy prior to delivery, and I was already taking iron. So I knew I was already starting at a low point. And so I wanted to make sure, that if I did drop low enough, I was willing to accept a blood transfusion, because I wanted to make sure I was going to be able to breastfeed, that I had everything I needed to at least recover.
Now, Brittney brings up a good point here. Anemia in pregnancy is pretty common. Why? Well, being pregnant can cause a dilutional effect. A good analogy is thinking about how ice cubes water down your drink. This is what's happening in the case of anemia in pregnancy. This is also the time that we are able to diagnose other people with other causes of anemia that they're unaware of. This could include low iron, other vitamin deficiencies like vitamin B12 if you don't eat meat, or hereditary disorders like sickle cell disease.
Exactly. And this is why when you become pregnant, we will check your blood levels at your initial appointment to assess this. And your blood levels will also be checked again throughout your pregnancy, because anemia can develop over the course of a pregnancy.
If we determine that your anemia is due to iron deficiency, we usually start by encouraging you to increase iron in your diet. But depending on how low your blood count is, then we may recommend a prescription for oral iron or liquid if you can't swallow pills. We will encourage you to take it with orange juice or vitamin C because it helps your body absorb iron better, surprisingly.
Now watch out, y'all, because iron can cause constipation. We recommend taking it at least every other day. During the pregnancy, your blood count will be checked again to make sure that it's actually improving. If it's not, then we may move on to IV iron. IV iron is when iron is given as an infusion, and it helps bring up your iron level count and your blood count. It usually takes about 3 to 4 weeks to work. So in the case if IV iron is going to be used, it should be done weeks prior to delivery in order to give it time to work. In rare cases, a blood transfusion may be needed to be given. However, we try to exhaust all options before doing this.
Nowadays, receiving a transfusion is much safer than in the past, and the risk of transmitting a disease like hepatitis or HIV is around 1 in a million versus 1 in 2 million. But a more common reaction is an allergic reaction, which can cause a low-grade fever and in some cases itching or shortness of breath. If you have a personal or religious reason for not accepting a blood transfusion, it is important to have a discussion with your birth provider prior to delivery and develop a plan for what you will accept in the case of an emergency. Most hospitals actually have consent forms that can be filled out for you and your care team to be on the same page about what other products and medicines you will or won't accept. Now let's return to Brittney's story.
Get back quickly to the postpartum hemorrhage. It sounds super scary. What was it like for your mom and your partner who were like in the room during all this?
I don't think my mom understood the gravity of the situation. And I think I don't know if she was like being naive to what was happening. I think my partner realized like the gravity of the situation. And I could tell he was concerned. And also, I think he was scared, seeing all the blood that they were collecting.
Do any of you deal with any of the trauma relating to that whole experience?
I think the trauma will come for me the next time I'm pregnant and when it's time for me to deliver, to think that is going to happen again. I don't have any other typical risk factors. I didn't have an infection during labor. My baby was on the bigger side, but not too large. I didn't have any retained parts of my placenta. It looked like it had come out intact. So I don't have any bleeding disorders. So I'm not sure what could have caused it.
Brittney has outlined some risk factors, which we talked about earlier, but sometimes we just don't know why it happens. Either way, it's important to know your risk factors or your history to decide where you're going to give birth and to notify your provider. Sometimes even without risk factors, it can still happen. Make sure the place you deliver is prepared.
So when you kind of reflect over your whole, birth and labor, how do you feel about your outcome overall?
I feel grateful, and I also acknowledge the privilege that I had as a OBGYN, and knowing the nursing staff and some of the people at the hospital where I delivered, but also realize that at the same time, I could have been a statistic. I could have been, I could have had, significant morbidity or even death from that situation.
Y'all, let me just say it. Giving birth is hard. That's exactly why it's called labor. Part of the difficulty is the emotional complexity of the situation. You are in one of the most vulnerable situations of your life, which can make it really hard to advocate for yourself. So please build your squad. Surround yourself with people who support you and can help you through this experience. Now let's hear the rest of Brittney's story. So did you experience any challenges at all in your postpartum recovery?
I think breastfeeding was probably the hardest part for me for a long time. I was producing, however, the pain, my baby had a tongue tie and a lip tie. So we couldn't get the tongue tie taken care of until like 2 weeks. But by that point, my nipple was like raw. And so we were trying to like exclusively breastfeed, and even pumping hurt. So it wasn't like I had an alternative. So that was a challenge, figuring out how to get the baby latched, and just, as your nipples become damaged, having to keep traumatize them, and not allowing them the time to heal. I applaud anyone who tries to breastfeed, even if they don't stick through it, because I'm not sure if my experience, I'm sure that it shouldn't have been that painful, but I know that most people experience some type of discomfort, and to be able to push through that discomfort or even try it out. I know it's very stressful for a lot of people not to be able to breastfeed or to have that pressure to breastfeed. And so that's kind of one of the things that I was mentally preparing for. I knew that breastfeeding was going to be a challenge, but I didn't know that it was going to be that big of a challenge for me.
Yeah, I can't imagine. That sounds very painful. Like literally, like your nipples are being rubbed with sandpaper. Is what I've heard it described as.
There was this meme that I saw because I was trying to explain to people like what I was going through. And there was a meme where this bear was going in like trying to attack or biting something. And that's what I felt every time I saw my baby coming towards my breast.
Rawr.
Yes, that's exactly what I felt. And so I knew that it was going to be a challenge, but man, like it took maybe 6 or 7 months to the point where I was like, I looked down while my baby was breastfeeding and I was like, I don't have any pain. This was the first time where I didn't have any pain, and it'd been 6 or 7 months. Yeah. So that was the hardest part for me. But I'm grateful that I was able to experience that, because now it allows me to help my patients. Like I always tell my patients, just give yourself grace. It's not going to come easy. And if you can't do it, at the end of the day, the goal is just to make sure your baby gets food and is fed. It doesn't matter how.
Being able to provide formula and clean bottles and nipples are an option. And so if that's what you need to do, the alternative is better than the alternative.
Exactly. It's like the same thing for like depression. Like if you have depression and your depression requires, more than just the lifestyle, changes. If it actually needs medication, your own mental well-being at the end of the day is going to allow you to be a better person, a better parent, a better partner. And so it's better to get treatment through pregnancy, after pregnancy, and, don't think twice about it, that you're doing what's best for you and your family.
Exactly. Do what you need to do. And no judgment.
Exactly.
I feel like sometimes we're our toughest critics, right? It is okay.
Yes, it definitely is.
I'm going to tell y'all what I tell all my patients. Fed is best, not breast is best. You have to decide what is right for you and your family. Check out kellymom.com, that's Kelly with a Y, for resources on breastfeeding and weaning, in addition to other resources.
What resources did you use to kind of help you with that challenge with the breastfeeding?
When I ordered my breast pump, actually, the company connected me with lactation consultants that you meet with virtually, and it's all covered through your insurance. So that was really nice that I was able to meet with them as frequently as I wanted to, and they would kind of walk me through. They would be on the video conference with me, trying to see how I'm getting the baby to latch. And trying to provide me with feedback on how to improve the latch, just to be able to speak with someone and show you what it is that you're trying to do or should be trying to do.
As you reflect on the journey, is there anything that you wish you could have changed or done differently?
I wish the castor oil would have worked.
And that you wouldn't be traumatized by it?
Yeah. That's one thing. No, you know what? I think that I see the patient side of going through a postpartum hemorrhage, and all the things that were going through my mind when I was experiencing that was like, I just had my baby and I'm not going to be able to see my baby grow up. And to know how all the things that are going through a person's mind when they're going through these, extreme experiences, I think it will help me the next time when I have a patient who's experiencing that, to provide that reassurance that I want to do everything I can to make sure you're okay, that you're going to be able to go home with your baby and your family, because it's scary. Like you feel extremely vulnerable, like your life is in someone else's hands, literally.
Anything else that you wanted to share or give advice to, other people who are expecting, who recently delivered, or who are supporting someone through a pregnancy?
I think that it's important to have a support system. If you are blessed and able to have people around you that want to help you, I know that sometimes I feel like I'm superhero and I don't ask for help. But I truly believe that it takes a village to raise a child, to have a family. And if you have any resources or support people around you that have your best interest in mind, you can't do it alone. And if you do it alone, it's not impossible. So people do it by themselves. But if you have support, I think if you can rely on them and know that you don't have to be superwoman or super person.
Exactly. Thank you for saying that. That's the whole point of the Birth Squad. That's why we're here, to help people to, better understand and be prepared for their experiences, but also to know that there's some resources out there, and to remind them that build your squad, build your people, your community to help you along the way, because it's not just a 10-month pregnancy. It's also a year-long first year of, postpartum delivery, and then motherhood, right?
Yeah. So definitely, I appreciate you guys for having me. And I didn't realize, yes, you need a birth squad. And that's exactly what you need. Because, man, if it weren't for like my family, my partner's family, my friends, my colleagues, like it's challenging. It's extremely, extremely challenging. So I'm very grateful.
Well, Brittney, I'd like to thank you so much for joining us and for being part of the Birth Squad, and for sharing all of your knowledge and experience with us and with our listeners.
Thank you for having me.
Well, y'all, thank you for listening to the Birth Squad.
We're going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts.
Remember, as you navigate your healthcare journey, that you are beautiful, you are brilliant, and you are brave.
We at the Birth Squad would love to hear more from you. Tell us what topics you'd want to hear more about. Hit us up on Instagram at The Birth Squad, and on Twitter @_The Birth Squad. Most important, make sure to share this episode with your squad. Until next time, I'm Dr. Ijama Okwandu.
And I'm Dr. Kamisha Thomas. Peace, love, and solidarity from the Birth Squad.
Check out the podcast description for the explanations on the terms that were mentioned in the podcast.